scene, app creating and promotions. Or if you want to shoot an advert for your business or a show, you can contact us on +1773 312 0318. For more information, you can visit our website at www.trendafricaonline.net and also on our social media platforms at Trend Africa TV. You can download our app Trend Africa Online on the Google Play Store and App Store. Trend Africa, redefining Africa.
Just as I am, without one plea, but that the blood was shed for me, and thou the beast me to come to thee. Oh Lamb of God, I come, and thou the beast me to come to thee. Oh Lamb of God, I come, just as I am, without one plea, but thy blood was shed for me, and thou the beast me to come to thee. Oh Lamb of God, I come, and thou the beast me to come to thee. Oh Lamb of God, I come, I come.
My name is Eunice Cromwell and I'm the business manager of the Ghana National Council. Make sure you always watch Trend Africa TV.
Welcome to Africa.
Good evening. My name is Dr. Araba and you are joining us live at Trend Africa TV in conjunction with Ghana National Council. This is Health Talks, and today we are going to be discussing the Ghanaian Community Health Clinic along with our partners. We will be joined by Dr. Chris and Mrs. Lynda and also Mr. Apia, who helps us take care of the lab, benefits, and pharmacy services for the clinic. Stay tuned. We'll be right back. I'm Dr. Araba.
It's Hot Ice exclusive on the beat. It's Hot Ice exclusive, the hit record.
My name is Eunice Cromwell, and I'm the business manager of the Ghana National Council. Make sure you always watch Trend Africa TV.
Welcome to Africa.
Chocolate is the first luxury. It has so many things wrapped up in it. Deliciousness at the moment, childhood memories, and that grind-inducing feeling of getting a reward. Now think about it. Chocolate presented as things you love the most. Yes, and edible too. Try our chocolate shoes and your love for chocolate will go a notch higher. You will never see chocolate just as a bar. Your imagination will go wild. Go ahead, take a bite. Kabi.
My name is Eunice Cromwell, and I'm the business manager of the Ghana National Council. Make sure you always watch Trend Africa TV.
Welcome to Africa.
Thank you once again for joining us. I'm Dr. Araba. Medical laboratory professionals provide clinical information and services that contribute to the effective delivery of care in today's complex healthcare system. They are indispensable partners in providing patient-centered care and improving health outcomes and overall public health. Clinical laboratories service as more effective. They also make sure that there's least invasive sources of objective information used in clinical decision making. Clinical laboratory services also have a direct impact on many aspects of patient care, including but not limited to inpatient length of stay, patient safety, resource utilization, innovation in care, customer satisfaction, and ultimately patient outcome. Medicare and Medicaid provide Americans with access to quality and affordable health care that they need to live happy, healthy, and productive lives. Medicaid provides comprehensive coverage to more than 70 million eligible children, pregnant women, low-income adults, and people living with disabilities. The Supplemental Nutrition Assistance Program, which is called SNAP, formerly known as food stamps, helps low-income people and families buy the food that they need for good health. Benefits are provided on the Illinois Link Card, which is an electronic card that is accepted at most grocery stores. That is what we are going to be discussing today. We are going to be discussing laboratory services, benefits, and also we'll be joined by Mr. Apia, and he will be talking to us about pharmacy services. Let me start by introducing our first guest, Professor Christopher Chalokwu. He is the president of Medical Assay Laboratory, which he and his wife, Dr. Irene Chalokwu, founded in 2005. He is currently professor at Emirates of Geochemistry and Physical Science at St. Xavier University in Chicago. He obtained his bachelor's with honors in geology in 1978 and a master's in geology in 1980, both from Northeastern University in Chicago. He earned a PhD in geology and geochemistry from Miami University, Oxford, Ohio in 1984. After a postdoctoral fellowship at Miami University, Dr. Chalokwu was appointed an assistant professor of geochemistry at Araba University in 1985, where he quickly rose to the ranks to become the first African-American tenured full professor in the history of that university. From 1990 to 1991, Dr. Chalokwu was a U.S. Senior Fulbright Scholar and a distinguished professor of geochemistry at the University of Ghana, Legon. He served as an external examiner for the University of Witwatersrand in Johannesburg, South Africa, and was a visiting professor at Middlebury College in Vermont. Professor Chalokwu was the founding dean of the School of Arts and Science at Benedict College in South Carolina. and Vice Chancellor at the University of Tennessee before joining St. Xavier University in 2001 as Vice President for Academic Affairs. Professor Chalokwu is a respected contributor to geological societies worldwide. He is an elected fellow of the Geological Society of America, was editor for the Geological Society of the America Bulletin, the Journal of African Earth Sciences, and the Journal Africa Geoscience Review. He is a recipient of the Ifortu Medal from Nigeria Mining and Geosciences Society for excellent contribution to geology of the African continent. And we are so pleased and grateful to have him joining us today. How are you doing, Dr. Chris? Good evening.
Thank you, Dr. Araba. Thank you for the invitation to join you tonight.
You're more than welcome, and we should just really be thanking you for your willingness to help us and everything that you did for us in terms of the clinic. So we are very, very excited for everyone who was at the health clinic. The person who was there that was collecting our laboratory specimens came courtesy of Dr. Chris, who has joined us as a partner for the Ghanaian Community Health Clinic. So once again, thank you for your service to humanity and welcome to Health Talks.
Thank you.
You're welcome. So we're going to go ahead and get started. So my guests, so my audience can get to know you. Tell us what happened that you chose this interesting field in geochemistry and geology?
Actually, I've always liked chemistry when I was a high school student in my native country of Nigeria. In fact, I used to have a nickname called Bunsen Burner, which means that I like to flame things up. And so when I came to the United States at age 21, I went to a university and I took a course in geology. So here I am interested in chemistry, but then by taking a course in geology, I found that to be quite interesting as well. So what I decided to do was to combine those two areas, geology and chemistry, and then pursued a track in geochemistry, which is a very exciting area of geology.
Excellent. And exactly for people who don't know what that job entails or what they research, what does that encompass? I know you mentioned geology, you mentioned geometry, and you mentioned other sciences, but what does it encompass in terms of the type of work that you do?
I am a research geochemist, so in my research track, I traveled all over the world looking at rocks, minerals, and magma. I used to go to whenever there's a volcanic eruption to be one of the people to go collect samples from the volcano because we want to analyze them and use them as a probe into what happened beneath the earth. It's a very broad field. It requires training in chemistry, in physics, in mathematics. But my interest is on the research track area. So as a professor, I did a lot of writing, both textbooks and publications and journal presentations, mostly dealing with physics and chemistry of rocks and minerals. How does a rock form? How does a mineral form? What are the chemical composition aspects? And of course, me migrating into medical laboratory is not accidental because most excellent laboratories are staffed by chemists. It's all about blood chemistry. So that's why that transition is easy to make from the classroom and the laboratory into the medical field.
Marvelous, marvelous. And we can see from everything that we read in your introduction that education is very important to you. Can you tell us a little bit about why education is very important to you?
Yeah, I think education is the foundation to most things that many people do. I think I'm sure you and your audience will agree that being educated is not just the ability to make a decent living, but it broadens your horizon. So I am an academic by training, means that I've spent a lot of my professional career running universities. As you mentioned in my biographic introduction, I was a dean, and prior to that, I was a professor. I've been a professor at many universities, both private and public universities, of varying complexities, from land grant institutions to research extensive universities, to private liberal arts colleges such as Middlebury College, which are quite elite, very selective institutions. And so having in all these different colleges and universities have actually solidified in my mind that I am an educator. Therefore, education is extremely important to me. I might add parenthetically, though, that my education is also extends to different parts of the world. So, for example, you read from my bio that I was a Fulbright scholar at the University of Ghana, Legon. Many of my friends are Ghanaians, and a lot of people think I'm Ghanaian, actually. And it's because I lived in Ghana as a Fulbright scholar. And while in Ghana, I had many talented graduate students that finally came to the United States to work in my laboratory at Auburn. So I believe in not just education, but also mentoring the future generation of students. And so I wouldn't have it any other way. I still like to do education, but unfortunately, I'm now Professor Emeritus, which means that I have resigned from teaching, retired from teaching, and now I'm focused on doing other things, including running the laboratory and the diagnostic and other businesses that my wife and I, Dr. Arian, share in common.
That's wonderful. And that's a great segue into our next segment, which will be talking about your laboratory. And you mentioned just that you have a laboratory and a diagnostic center. So let's get started now. We're thinking about the person who may not have any health insurance and may need to have some type of testing done. So first of all, tell us where your lab is located.
Yeah, the lab started in 2005 in Westmont, one of the western suburbs of Chicago. Mm-hmm. And when we grew very big, we decided to move down the street from Westmont, Darien. So we are now located in Darien, Illinois, also in the western suburbs. As I mentioned, the lab has been around since 2005. We see a lot of patients with different case histories. Mm-hmm. We work with providers, and by providers, I mean doctors, different specialties, physicians, nurse practitioners, physician assistants, and so on and so forth. We also have a subsidiary of our medical assay company called Complete Diagnostics. And the role of Complete Diagnostics is to help diagnose diseases. We do ultrasound, echocardiogram, arterial and venous Doppler, and we do that at patients' homes primarily. Or we can come to a physician office and have our technicians set up a portable device to do those studies in the doctor's office or in a clinic. So we accept all forms of insurance, public aid, Medicaid. We also accept, obviously, private pay. But we also have a sliding fee schedule for patients that have no insurance. It's amazing that there are many patients in this country that do not have access to health care. Mm-hmm. And so when they present to us, what we try to do is to work with them to make it easier for them to afford a basic laboratory testing. Just to give you an example of how that works, if you present yourself to our laboratory to have your blood drawn and you don't have any insurance, we could charge you for a complete blood count, which we call CBC. We could charge you $10 for that. All right, if you go to the hospital, it's like $300. I mean, the hospital rates are different, obviously. And we do that because we want to provide health services to people that are uninsured. We also do COVID testing, which is one of the things we did at the clinic last time that my staff was there. The COVID do free of charge. We do not charge the patient for the COVID testing because we are in a pandemic. So we submit their information to the uninsured program that the federal government handles on the side. So we encourage people to, do the COVID testing without paying for it because it's required. There's a government program that will pay for those type of tests.
Thank you. And so tell me a little bit about the mission and goals for your laboratory and diagnostic center. What was the reason why you decided to put this in place?
First of all, I was the provost and vice president of academic affairs at St. Xavier University, 2001, 2005. Once I stopped being the provost, and so the provost is a very complicated position. I mean, all academic problems end up on my desk, whether it has to do with students, faculty, parents, and students, and all kinds of issues. And so having that high pressure position kept me focused. However, once I stopped being the provost, I found out that I have all this time on my hands, and I said, what am I going to do with myself? So I decided with my wife, Dr. Chalokwu, that we need to do something different. So we founded Medical Assay Laboratory. The mission of Medical Assay Laboratory is to produce quality results that will help healthcare providers to diagnose patients. We believe that we can partner more efficiently with healthcare providers. And we see that the delivery of healthcare is a collaborative project between the provider, the doctor, the physician, the specialist, the nurse practitioner, physician assistants, and so on and so forth. And even the nurses, because the nurses also work with these patients. We see that as a collaborative effort between these different people and entities with the laboratory. And we see the laboratory as being a central linchpin in this relationship because the information that we provide helps the clinicians, helps the doctor make a very important and informed decision. And so we tend to work collaboratively with different providers. Our mission has always been to simplify healthcare. And by that, we mean to provide information that makes it easier. But we also like our patients to be part of this exercise. So we send our results to patients. So when we run tests, we give the results to the patients so they know what their data is. They're going to get it from their doctor too. But we have a system where they can look up their results from our portal. They can log in and get the results themselves. So that when the doctor is talking to them, they are also well informed about their health condition. So it's a very robust mission. And same as the diagnostic, the mission of complete diagnostic is to provide services at the comfort of the patient's home. Because some of the exercises or some of the tests that we perform are tests that if you have to go to the hospital to do them, one, they're more expensive, and secondly, we are portable, so we can come to you instead of you coming to us. Therefore, we provide a very vital service for the homebound patients, those patients that are bedridden and are not able to ambulate properly to leave the home for extended periods of time.
Absolutely. And that is a very, very valuable service. I think being able to get your blood work and being able to get certain diagnostic testing that perhaps you wouldn't be able to maybe walk into the hospital, as you spoke about people who are bedbound or even having ambulation problems, we can see this as being a very valuable service. Now, when it comes to the community clinic, I know when I reached out to you for the community clinic, you didn't think twice, but to just say, oh, yes, I'll do it. What drives you to also be able to give back to the community? Because I know that you've been helping many, many people to be able to get blood testing done, diagnostic testing done, whether they have insurance or not. You talked about your sliding scale. So what drives that?
That's an excellent question, Dr. Araba. I think it's very important for one to give of their time and resources whenever they can. That's why I'm very much appreciate what you and your colleagues are doing for the GHANAIAN National Council, because you also volunteering your time. As they say, time is money. So if you don't have the physical cash to give, then you volunteer your time also. What drives us is the idea that we are in this together, meaning that we need to be able to give back, and that the community has been very helpful to us. I mean, we have a location in the south side of Chicago, 110th and Austin, and people come in there. Actually, that area is supposed to be it's designated as a federally underserved area. And so, because it's federally underserved area, we have a sliding scale. People can come in and we do tests for them. If they don't have insurance, we just charge them $1. Well, that $1 is actually intended to make a statement. Not that our cost is $1, but we just want to make sure that they feel empowered to participate in their healthcare. So they come and do some tests and see a nurse practitioner, a PA, and then we charge them $1, and they're very happy to pay $1. So it's part of giving back to the community.
Yes, and I like the fact that you said that it involves them to be involved with their healthcare, because that is very important. Empowering patients to be able to take control, look up your own lab results, do research before you even see your provider to maybe see what your lab results mean. It means a lot. And you are teaching people how to take control of their diabetes, their cholesterol. These are all ways that can really help. So we are very, very excited that you are partnering with us. And for the health clinic, you guys have all heard what Dr. Chris says. His job in the health clinic is to help us with diagnosing correctly. You can look at someone and you can assess someone. You have your stethoscope, you have your equipment, but what will take it further is to have diagnostic testing. What will take it further is to have blood testing. And that is the reason why when we developed the health clinic, we knew that we needed someone from the pharmacy to help us with our medications, and we needed to have diagnostic services. So we are extremely excited. Let's take a quick break, allow everyone to get some water. If you haven't shared the page, please share it. Tell a friend to tell a friend that Dr. Araba is on. This is Health Talks. We'll be right back.
Fellow Ghanaians in the Chicago area. My name is Dr. Prince Hodogbe. I am a family practice physician and have been practicing in the Chicago area for some time now, for a very long time actually. The Ghana National Council and the Ghana House Incorporated are coming together to continue the health and wellness expo that has been going on in the community before COVID came in. We plan to screen for common diseases like diabetes, high blood pressure, high cholesterol, some skin diseases, and many of the women health problems. Our first event is planned to be on November 13th, 2021. We also plan to educate the community on the vaccinations, especially the COVID vaccines, and also the influenza vaccines. And if possible, we are planning to have some supplies of the COVID and the flu vaccines and give them to people who have not yet received their vaccinations, especially the COVID vaccines at that time. We encourage the community to come in their numbers and participate in this event. As I said, if we have more people participating, we may increase our once a month event to maybe twice a month, but that depends on the number of people who come in to the first event and people who are interested in the events going forward. The first event will be held at the Methodist Church on North Killer Avenue. The exact address is 4047 North Killer Avenue, Chicago. And we plan to see as many people as we can see on that day. The event starts from 11 o'clock and runs through 3 p.m., 11 a.m. to 3 p.m. We want to see many people in that event, and from that point on, the second Saturday of every month, we will be holding this event from Ghana National Council in conjunction with Ghana House Incorporated.
My name is Eunice Cromwell, and I'm the business manager of the Ghana National Council. Make sure you always watch Trend Africa TV.
Welcome to Africa.
Thank you very much for tuning back in with us. I'm Dr. Araba, and this is Health Talks, and we are speaking about the Ghanaian Community Health Clinic that was just opened on Saturday. We had a lot of people come, but we would like to have way more people come. One thing I'd like to just say is that a lot of people sometimes get uncomfortable when you come to see someone. Maybe you think the person will share your information. Let me just assure you that everyone who volunteers their time at the Ghanaian Community Health Clinic is a professional. We've all taken an oath, and we know about HIPAA, and so none of your health information will be shared. We do have a lot of success stories. There were people who came, we were able to adjust their blood pressure medicine, and those things are what makes us continue to want to give this service, because we know that there are a lot of people who, for many different reasons, do not have primary care providers. We are here for you. We are available for you. We have open arms, and all we want to do is take care of you. So if you were not able to come last week, Saturday, we hope that you can come next month, and you can bring your family, you can bring your friends, come get checked out, come and spend some time with us, come and have some food, and just enjoy. That is all we're here for. We're going to switch gears a little bit. We've been speaking to Dr. Chris. He's going to join us back in a little bit. He talked to us about his laboratory and his diagnostic center. But now I'd like to bring on Mrs. Lynda. Mrs. Lynda Korsah is currently a practicing benefits specialist in Northfield, Illinois, managing the Older Adult Benefits Program. And she has information and resources for older adults and families. She comes from an active career in city planning and community health that is the foundation for her recent role to provide social services support to adult families and other family members, As a benefits counselor certified in the Senior Health Insurance Program, which is called SHIP, she answers questions on Medicaid and Medicare components that cover healthcare options for older populations and families, and helps people navigate benefits that they may qualify for and bring much needed help to individuals and their families. Mrs. Lynda has a broad experience in Ghana and the United States, covering city planning and development, environmental health and sanitation, public health, and social services. Mrs. Lynda supplies direct aid in cash and in kind to elementary school programs and families in Ghana as a volunteer through a non-for-profit organization which she founded. She is a former city planner and chief of staff of the City of Chicago Local Government Leadership. Prior to that, she worked with Age Options, a non-for-profit organization that supports and gives grants to social service agencies to help seniors get the benefits that they need. Mrs. Lynda has a Master's of Science in Urban Planning and Policy from Rutgers University in New Jersey, USA, and a Bachelor's in Development Planning from from the University in Kumasi, in Ghana. She moved on to the public to do her Master's in Public Health at the University of Illinois in Chicago, and she worked in community health research at the University of Illinois with older populations. She later worked for the development of human services, providing assistance through social work, helping individuals and families apply for benefits. She is currently a PhD candidate at Walden University with a research interest in fall prevention among older population. Prior to her work in the United States, she successfully dedicated initiatives that involves community-level projects and environmental health and sanitation solutions, including recycling and clean air initiatives. She has broad experiences and a background that gives her the knowledge, diversity, and insight to help others. And we are so excited to have her here today. Mrs. Lynda, how are you doing today?
I'm doing good. Thank you so much for having me.
You're welcome. You're welcome. And thank you so much for your response to the call of duty. She's actually, we were very happy when you reached out and said that I can help, I can do benefits. It became a very valuable part of the health clinic, and we are excited to be partnering with you so you can be able to help our community get the benefits that they don't know about. So we are very happy that you have joined our team. We know at the end of this, all this is going to benefit our community. So all good things are going to be coming out of this. So thank you once again. So tell us a little bit about your research that you're doing with the fall prevention. What made you choose that?
Well, as you have said, I have worked for many years with older populations, and I developed an interest in healthy aging. So that was one of the key subjects that I covered when I did the Master's in Public Health. And that was due to the work I had done with older populations, both in running programs that would support them and in actually direct care and support. So I realized that a lot of seniors have falls, and looking at the public health perspective, it's obvious that it's a public health concern, and in fact, 1 in 3 older adults fall each year, and therefore you want to look at how to prevent those falls. I was involved in research at the University of Illinois on how to prevent falls in older adults using physical therapy, balance therapy, different types of exercise programs to help seniors who are frail and disabled to strengthen their muscles to become stronger to prevent them from falling. You'll realize that an older adult that falls one time is likely to fall again. But at the same time, working with older adults, you realize that even though they have home care help in the home with 24/7 care, it does not prevent them from falling. One individual who falls again and again and again, and then develops a fear of falling. An individual who falls and is afraid of falling doesn't want to get out of bed once they've broken their hip or had a catastrophic accident or effect from the fall. So I began to look at research that has looked at fall prevention, and the research is unbelievable. There's so much research on fall prevention. But now with the COVID, there's a lot of research coming up about social isolation and fall prevention. And I have a lot of anecdotal stories to tell about how social isolation affects older adults and causes them to decline and not thrive and then be susceptible to falls. And not only falls, but actually a decrease in their cognitive abilities and how they are able to handle their activities of daily living, which is activities like bathing and walking and cooking and daily other daily activities. These are activities that when they have a fall, all of a sudden they can't do anymore, and then they have to get people in the home to help them. So I developed a passion for working with older adults, and I want to see how I can find the best research that would that shows that improvements can be made and people can be offered programs that would help prevent them from falling, um, at least the many times that they're going to fall, and prevent them from going to the emergency room repeatedly. Once they have a fall, they go into the emergency room, they get sorted out, they come back home, and then there's another fall and another fall and another fall. So we're looking at programs that would help with that. And I'm just focusing, I'm still researching the data, looking at different research that has been done just to find the one peculiar research that is worth studying. And so at least I've honed in on the social isolation aspect and how it affects falls among the older population. So
Excellent. Wonderful topic. Definitely something that needs to be researched a lot. We know when we're taking care of all of our geriatric patients, that's one of the biggest concerns, falls, and as you touched on, hip fractures and other issues that come after the hip fractures, including bleeding disorders and everything. So very, very good job, and wishing you all the best on your research and your upcoming PhD. So let's go ahead and talk about benefits, because I will tell you that we've received so many calls that, oh my goodness, we didn't know this was going to be going on there. So people are very much in need to find benefits. And we do have someone who actually called us and said that you helped them sign up for some benefits and they received some emergency benefits today. So thank you very much for your service on Saturday. So let's just get to it. So Medicaid, a lot of people, maybe they know or they don't know, but go ahead and tell us, what is Medicaid and how does one qualify for Medicaid?
Well, Medicaid is a very big program. It's a public aid program. It's basically a health insurance program that helps people with lower incomes. So there are income guidelines related to the federal poverty levels, and that is how you can qualify. It comprises of health care for different groups of people, from children to adults under the age of 65, to adults that are disabled under the age of 65, to seniors over the age of 65. And there's a new program for immigrant seniors over the age of 65. And then you have assistance for what they call moms and babies. And this is for pregnant women when they're for a short time when they are pregnant, and then when they deliver, they have services for about 2 months, and then after that, the child that they delivered also has services for a few months, sometimes up to a year. So there are different programs within the Medicaid program. So starting with older folks, I'm working with older folks to get approved for a special program for older adults over the age of 65. Once you get to 65, they put you in a certain bracket, and this is the aid to the aged, blind, and disabled. That's what it's called, AABD. So when you're filling excuse me?
No, I'm listening. Mm-hmm.
Yeah, so when you're filling the Medicaid application, it will ask you if you're interested in the Affordable Care Act, which is the the adults under 65 years, from 19 to 65, a program, or the Aid to the Aged, Blind, and Disabled program, or emergency medical care, or and this is what is offered on the application. And so the Aid to the Aged, Blind, and Disabled is a program that is qualified by income. The income is, to get full Medicaid, the income is really low, about $1,098 a month, and this is what is used to qualify you as a single person in a one-person household. When you have more than one person in the household, this number goes up a little bit. With two people, it's about 1,400. But with the older people, the 65 and older, there's also the assets that are added. So if it's a single person, you can't have more than $2,000 in assets. If it's a couple, no more than $3,000 in assets. And there are different variations of this as well, depending on if you have a spouse that is going to a nursing home and you are the spouse left in the home. That is another category of Medicaid that is called prevention of spousal impoverishment. So that it protects the spouse that's remaining in the community, whilst their spouse is in the nursing home and applying for Medicaid. So that in that case, the assets are even different and much, much more, so that it can maintain the spouse that's left at home. And then you have the general adult, which is called ACA Medicaid, which folks can apply for as an adult, and based upon your income, ranging about 2,500 a month, you can get qualified for that. Of course, they ask for your income, proof of income. There's a document checklist that lists everything that you need to provide for your qualification. And with Medicaid, it's more or less a lot more straightforward than, say, SNAP or CASH, or the Medicare Savings Program. So when you're asking for Medicaid and you're approved, there are certain the different types of Medicaid that you could be under. There are the managed care organizations that have contracted with Medicaid to provide a service to manage you, and therefore you have to go to providers that are within their network. And then there's the original Medicaid, which is the original Medicaid, and you can go basically anywhere. You're not really managed by any specific organization. So that's how it works, basically.
So your job is to understand someone's situation and then make recommendations as to which program they could potentially be accepted into, whether it be Medicaid or Medicare. Is that correct?
Well, Medicaid and Medicare are two completely different things. Like Medicaid is a health insurance that provides healthcare options for basically the general public. And then they've added a component for seniors, which is the AABD I talked about. Medicare and Medicaid is actually federal and state funded. So it's run alongside Medicare, but I would say it's more of a parallel program that sometimes picks up the 20% that Medicare does not cover. So Medicare is a broader program, basically for people 65 and older.
Okay.
And those who are 65 and who are 64 and younger and are disabled can qualify for Medicare and be given Medicare if they've been disabled for about 24 months. So they get all the benefits of the Medicare Part A and B. Medicare originally is split into two. You have Medicare Part A and you have Medicare Part B. Part A is covering inpatient hospitalization, and it has a certain number of days that you're going to be in the hospital that Medicare will pay, and it's still, and then at the end of the day, Medicare will not pay at a certain point, because Medicare does not support custodial care. Custodial care is classified as care that is like care in a nursing home where you're just being taken care of by long-term care staff and support services like that. But Medicaid will pick up long-term care support services in tandem with Medicare. So even though they're two separate programs, they do work in tandem. And Medicare has different components, and that is where a lot of the confusion is now, because you have Medicare Part A, Medicare Part B. Part B covers outpatient care, physical therapy, all the other outpatient and doctor's visits, and all the things you do outside of the hospital is covered by Medicare Part B. And there's a premium for that. Even though you pay into Medicare to get Medicare, there's a premium for the Part B, and it's $148.50 for most people. So about a month, yes. And it's taken out of the Social Security check. If you have a Social Security check, it's taken out of there. So that's a very important piece of Medicare that leads me to move into the Part C of Medicare. Medicare Part C is the Medicare Advantage plans, which is like a managed care organization, health insurance organization that is managing Medicare Part A and B for Medicare, and they have their own rules, but they have perks as well. So the Medicare Part C, if you hear the advert on TV, you have to listen very carefully, because they'll give the impression sometimes that the Part B premium is being covered, but it's not. Part B premium is not being covered by the Medicare Advantage plans. Even if you go to a Medicare Advantage plan and there's no premium, there is still the Part B premium that you have to pay. And then some of the parts, the Medicare Advantage plans also have drug prescription plans roped into it. And they do that because when you have original Medicare, Part A and B, you also have Part D, which is a drug prescription plan. And this is a plan you have to sign up for. It goes on and on and on.
Everyone's confused by it, but I'm very happy that you are so well knowledgeable about it, because we need for you to be able to really break it down for people. And so my goal for bringing you on the program is to allow people to know that, yes, there are benefits available. Yes, you are the one that they can ask. So tell us, what does someone do? So I'm looking at all these programs and you're explaining it beautifully, but what do we do for the person who has no papers? What do we do for the non-citizen or the person who just has no legal status at all? What type of benefits are they eligible to have, or what type of assistance is out there for them?
Well, I only talked about Medicare and Medicaid right now, but even within the Medicaid program is where I would say that they could benefit. Is undocumented people are not in any danger when they apply for Medicaid, but they are eligible for emergency medical care. Is what a lot of them would probably be eligible for, and they can get approved for that for the period of time that they need it. And if it stops, they can always apply for it again the next time they have something that is really emergent, as I would say, yeah. So
so it only covers one instance. So for instance, you'd be able to get it and it would cover maybe a episode of something. If you had something wrong and needed a short-term treatment, it would cover that, but it doesn't continue on. Is that what you're saying?
It wouldn't continue on for someone who's under 64 and trying to get Medicaid and doesn't have the papers. They take your information, and even if you don't have a social security number, if you have an ITIN number, that would work. And it's just the emergency medical that you can get at this time. And emergency medical does not affect them. Some people believe that when they take the Medicaid for a short term, or they take it when they need it, it affects them later on when they're getting their papers sorted out. But it's and that's called public charge, but it doesn't affect that. As long as it's emergency medical, it doesn't affect that. If somebody is undocumented, is pregnant, they would get it under the moms and babies. But otherwise, they need to have some documentation to get a standard long-running Medicaid approved for them for like a year. If they're over 65 and they're applying for it with the new policy for older adult immigrants, they can get it for the year. Medicaid, when they approve it, is for a year, and then it's redetermined at the end of that year. And this is being, there's a new policy to help older adults that are immigrants. And typically when they're immigrants, if they have a green card and they haven't been in the country for 5+ years, they really don't qualify for Medicaid. But because they want to help the seniors, they allow the seniors now, even if you haven't been in the country for 5 years, you can apply for Medicaid now as a senior and get it for 12 months, like anybody else. So it's a bit limited for undocumented, but it is available at least for emergency medical, and it works a lot of the time for people like that.
Okay. And you're saying for the seniors, the correct definition would be 65 and older, correct?
65 and older that are immigrants, and I've only been in the country for a short time, up to 5 years. If you're 5 years plus, really, and you have a green card, you can qualify for Medicaid.
Okay. Okay, very good. And tell us a little bit about SNAP.
So SNAP is the other benefit under the public aid umbrella, and this is a food stamp that you can apply for. The income levels for food stamps are a little higher, about $2,100 for a single person household. But the SNAP, because of the COVID, a lot of things have been waived. Just like with the medical, a lot of things have been waived. They don't look at assets. SNAP, there's no assets to be considered, but they will look at your housing expenses. And they do ask for medical bills to look at your expenses generally in the home. So you can qualify for SNAP. There isn't any, the only emergency SNAP is for somebody who has submitted an application and the rent that they're paying or the mortgage that they're paying is more than the income that they have declared or they have provided proof of. And then the DHS does expedite an emergency SNAP to make sure that you have some food to eat. And I would say that for the COVID period, they have done so well by they've increased the SNAP for single person, and they were quite lenient in giving out the SNAP cards just to make sure that people had food stamps to go and get some food. But as with undocumented, there is nothing that I'm aware of that you can get as for SNAP benefits. It's more for the medical emergency.
Medical.
Yeah.
Very good.
The emergency SNAP is really for an individual who has documentation at least and needs the emergency food stamps.
Okay. We're going to take a quick break. When we come back, we're going to be joined by Mr. Apia, who is the owner of Home RX. He is our pharmacy partner. We'd like for him to also explain what services he's going to be providing and helping with the health clinic. So just remember, there's a lot of information, so you can always go back and watch it. But remember that the Ghanaian Community Health Clinic's goal is to make sure that we can provide you with quality healthcare and services. So we do have a lab. We have a diagnostic center that we partnered with. That was what Dr. Chris was telling us about. And then Mrs. Lynda is here to answer any questions that you may have in terms of benefits. Remember, the clinic itself is free, but there may be other things that you need. If you need to have surgery, if you need to do other things, you may need to have some health insurance to cover that. Also, eventually, having health insurance will enable you to have a primary provider, detect other things that maybe cannot be detected in the clinic. So our goal is really to have everyone have some type of health insurance, and we can still continue seeing you. And then our last component is our pharmacy component, because if we prescribe medications, we want to make sure that people are understanding their medications and know where they can get their medications. And that's where Dr. Ofori, who is our pharmacist that joins us, he'll be on a little bit to talk about COVID-19, and Mr. Kwabena come inside. So stay tuned, get some water, tell a friend to tell a friend that Health Talks is on. I'm Dr. Araba. We'll be right back.
Looking for that special gift for that special someone? Looking to bring life into your personal or family portraits? Art Bank is your creative bank of art solutions. We provide a wide range of digital photo editing and paintings that will transform your images into exquisite yet affordable pieces of art. We bring old photos back to life. Your photos can be framed or made into canvas prints of any size of your choice. Our ultimate goal is to bring into your homes and offices amazing masterpieces through eye-catching portrait paintings for occasions such as birthdays, graduations, award ceremonies, funerals, and many more. You can locate us on Instagram at @bankgh. You can also contact us on 312-609-9907 or @bankgh@gmail.com for all your inquiries. Art Bank, reviving your images.
Welcome to sankofaonline.com. Your #1 diaspora news portal has joined with GhanaWeb.com to bring to you the latest news around the world, especially Ghana. Visit our website at www.sankofaonline.com, or you can download our app from the Google Play Store or App Store. Sankofa Online, serving the Ghanaian Chicago community.
Check out this beautifully made artistry of coffee tables made from a combination of recycled tires, jute ropes, wood, and fabric to suit your style. Yes, we make to order. These coffee tables can help you make a statement in your bedrooms, offices, and living rooms. But remember, we only ship within the USA and Canada after shipping cost is paid. Call Jasper Designs on 1-306-203-2650 or email us at doduyayra@gmail.com. Follow us on Instagram at Jasper Love or follow Pearl Yara Agboka on Facebook. Don't be left out. Please place your orders now.
My name is Eunice Cromwell, and I'm the business manager of the Ghana National Council. Make sure you always watch Trend Africa TV.
Welcome to Africa.
Thank you once again for joining us. I'm Dr. Araba, and today we are speaking about the Ghanaian Community Health Clinic, and we're speaking to some of our partners that are helping us bring this reality. Next, we're going to be speaking to Mr. Kwabena Appiah. He is the owner and founder of Home RX1. He's originally from Ghana, attended the College of DuPage in Glen Ellen, Illinois, and studied pharmaceuticals from about 1996 to 2000. He says his Christian faith plays an important role in his life, and he's proud to be the leader of the Men's Fellowship. He's happily married to his wife, Mrs. Karen Appiah, and they are parents to 9 children. In his free time, he enjoys watching sports and spending time with his family. In 2010, he became the co-owner of Home RX Limited with the intent to extend pharmaceutical care without boundaries. He is dedicated to working with every patient's particular needs and make sure that they can receive their medications. He's serving his community in a way that has brought such a sense of fulfillment and purpose to his life. There are no boundaries to the number of elements a person can experience. He intends to grow his mission so that no person experiences boundaries to the individualized care that they need or they receive. And we are very grateful to have him joining us today. Mr. Appiah, thank you very much for joining us. How are you doing today?
I'm doing fine. What about you?
I'm doing well. Thank you. Thank you. I know everyone is so busy, so I'm always so grateful when people can show up and just explain to the community what we are doing. So tell us a little bit about your pharmacy and the role that you're going to be playing within the Ghanaian Community Health Clinic.
Okay, the role of Home RX1 is when we started Home RX1, we found the need that there are some people who are falling in between the cracks. And when we find out, we wanted to find a way whereby no matter who you are, no matter what your background is, and no matter what even your education or your status is, as long as you come to our door, we want to find a way to help your need. We don't want to ignore anybody. So by so doing, we have a lot of few services that we add to our pharmacy that really, really help everybody that comes through our door. And most of our patients are seniors. And because we saw that the seniors are the ones that need a lot of attention, they need a lot of services, and they need a lot of help. So that is one of the main things that we decided to have Home RX1. And after we started the pharmacy, we are very well in helping a lot of people. And we hear a lot of testimonies, and we hear a lot of people saying how we have been a help to them. And they like even our website because when they go to the website, there are few information that they did not know about. And when they go there, it explains a lot of things to them. So these are a few things that we decided to do. And so far, we are helping a lot of people.
Wonderful. And we know that your pharmacy provides delivery services. Tell our audience a little bit about how the delivery service works and what areas you deliver to.
We deliver as long as you live in Illinois, we deliver everywhere because we have patients as far as Rockford, and we have few patients in Kankakee, and we have patients in Champaign. And as like I'm saying, as long as you are in the state of Illinois, if we cannot come to you, we will either mail it to you, and we mail it in such a way that we mail it through UPS. So if you even order some medications through us, you will get it the next day.
Okay.
And if you live around Chicago area, we have people who will deliver the medicine to your house. And if they come to your house and you have any questions or any concerns, they could help you. Or if they cannot help you, they will let the pharmacy knows, and we are able to address every concern about our patients.
Marvelous. And we know that your website also does an excellent job teaching people about their medications. Go ahead and tell our viewers your website and what they can expect to find if they were to visit your website.
Okay, our the website address is homerx1 spelled out .com. And one of the things that I like about the website is any medications that you have even in your hand, there is a research button on there. And when you tap the research, under it, you will see med info. And when you go under the med info, you can type in any medication. And when you type in the medication, sometimes if you put the first 3 or 4 letters of the medication will spell out, and you will tap it. And when you tap it, one registered pharmacist from an organization will come to the screen and they would talk to you. They would tell you the side effects, the doses, and how effective, and a lot of information about that medication. And if you want to read, there is a long portion that you can even read yourself. And that is one of the best tools that is on the website, that a lot of our patients, when we explain it to them, they are so happy. So even if the pharmacy is not there, because of what we show them at their own leisure time, they can go on the internet, and all the medications that they are taking, they can know every information about the medication, the reason why the doctor even prescribed the medication to them, what it does to them, and all the benefits to them. So with that, the patient is aware of the medications that they are taking. So that is very, very informational to them, rather than some other things. The patient would not even know even the name of the medication. All that they know is, oh, the doctor says I should take this one 2 times a day for my diabetes. But when you go to our website, it tells you more, and it helps them to have more information about the medications.
Excellent. And I do think that is a very important component. So a lot of people like to know everything that's going on about their healthcare. And even though when you do go to an appointment and the doctor will tell you what you're taking the medication for, it is a partnered effort with pharmacy and pharmacy staff for them to be able to complete the circle, to provide that patient education regarding the medication safety. That is what most providers also rely on, right? We prescribe medications, and then we know that the pharmacy is also going to go in detail to make sure the patient understands a safe way to take the medication, make sure they're not interacting with anything else. So I really do love that about your website. The Ghanaian community, of course, is very, very excited to be having this clinic. And again, this could not be possible if we didn't have such good partners. As you can see here, that slowly but surely we are building a clinic that is going to really be able to provide everything that you will need, from benefit services to laboratory and diagnostic testing, and then of course to pharmacy services. So we are very excited to have all of them here today. We're going to take a quick break. When we come back, we'll bring all three of them back, and we're going to talk about their experience at the community health clinic that we just had on Saturday. Stay tuned. We'll be right back.
To advertise with us, donate sponsorships and suggestions, email us at trendafricatv@gmail.com or call us on 773-312-0318 or 773-756-6678. Remember to also follow and like us as Trend Africa TV on Facebook so you can always catch us live. On Instagram as Trend Africa TV 123 or subscribe to our YouTube channel as Trend Africa TV and click on the notification button to watch previous shows. You can also visit our website for your African news, entertainment, fashion and sports updates on www.trendafricaonline.net. Trend Africa TV, redefining Africa.
My name is Eunice Cromwell, and I'm the business manager of the Ghana National Council. Make sure you always watch Trend Africa TV.
Welcome to Africa.
Welcome back. I'm Dr. Araba. We're going to be bringing all three of our guests, but before we bring them in, let's get a quick update on our COVID-19. Dr. Forey is here joining us, and he always brings us the latest information in terms of COVID-19. So let me just go ahead and introduce him. He's right backstage. So So Dr. Edward Ofori is an assistant professor of pharmaceutical sciences of Chicago State University. He is a pharmacist by training. His research focuses on drug discovery of neuropsychiatric disorders, including schizophrenia, depression, and substance abuse. And he always is with us. We're so grateful to have him. He's also the pharmacist in charge of the Ghanaian Community Health Clinic. So he's going to be telling us all about COVID-19. Dr. Ofori, how are you this evening?
I'm doing great. How about yourself?
I'm doing well, thank you.
Awesome. Great. So I'd like to thank everyone who has tuned in this evening to listen to us. Our health show has been going on for some time now, and now we're expanded it into the community where we're going to be delivering healthcare to individuals that need it the most. I'm just going to do a little bit update on what is going on in the COVID world. We know the COVID is here, and we've been talking about it every now and then. But if you watch closely in the world, a lot of the cases are going up, especially in the US. We do see an uptick in cases, and we also think that as the holidays come up, we're going to see a surge in cases around the United States. If you do a comparative look at the death rate around the world, places like the US and UK don't have seemed to stabilize the number of deaths, but then it's still a lot, especially when you have over 1,000 people dying in the US every day due to COVID. And when you go to places like Ghana, you occasionally see a spike in numbers, but most of the time it's at a very low rate compared to the population or the number of incidents that we see in Ghana. Also, if you look at retrospectively, if you look at last year around this time, you can see the big spike which happened around the getting to the end of the year 2020. We did see an increase in numbers around that period, and we kind of anticipate that it's potentially going to rise, but not to the extent that we saw last year, which makes us want to advise our listeners to exercise a lot of caution as you travel. You go to Ghana and all other countries, you make sure that you protect yourself, because we do know that numbers are going up around the world because of the Delta variant. In addition, we do see that there's, if you look at the number of case deaths, we don't see that uptick, but we do see cases going up, but we don't see the deaths going up at this point. But we always know that the number of cases will always go up, and then it's followed up by a spike in number of deaths. We also anticipate, and pediatricians in the US kind of warn parents that there's probably going to be a high rate of infections, and therefore you have to make sure you protect your kids. If they do qualify for the vaccine, please don't hesitate to give them the opportunity to have that. Illinois, we anticipate that there's going to be uptick in cases, especially in schools, as we head out for Thanksgiving, because a lot of people are going to come together, and that is when there's a higher chance that the virus is going to spread. Now, the interesting thing that we've found this week is that a lot of pharmaceutical companies, including the likes of Pfizer, are investigating and researching on drugs that can potentially be used to treat the coronavirus disease. We've looked at antiviral agents, including the likes of ritonavir, which Pfizer just a few days ago came out with a study that says that almost 90% efficacy in terms of reducing hospitalization and death in people who are susceptible to severe conditions. We do know that around the world, over 52% of the population have at least received one dose of the COVID vaccine. Close to almost 7.5 or 7.5 billion doses have been administered. So the doubting Thomases around there who still want to wait on data, this must be one of the biggest trials ever that has been carried out in the world, with close to over 7.5 billion people that has participated. So at this point, we do know that individuals who do not have the COVID vaccine have a higher risk, higher chance of being hospitalized when they do get COVID infection. Also, they are about 11 times more likely to die from COVID compared to their compatriots who are fully vaccinated. Now, if you look around the world, especially in terms of percentages of population that are vaccinated, you do see that the United Emirates stands out to be almost 100% that have received at least one dose of the vaccine. United States, that seems to harbor a lot of the vaccines, hasn't seen a corresponding increase as we see in other countries. which makes the WHO worry about, giving booster doses in countries that already have very high numbers of vaccination. As we go along, we do notice that those who are fully vaccinated has increased over the time, but then it's kind of stable. We kind of plateaued. Even though there's been a lot of mandates from the federal government, we still don't see a corresponding increase that is so significant to drive the numbers up to like 80% at this point. In terms of age aggregations, we do know that children who are or adults, I would say younger adults who are more than 12 years of age, we see a very good numbers. Almost 80% of them have at least received one dose of the vaccine. You can see that there's a very high patronage in individuals who are 65 years and above, which makes us, a little bit comfortable because these are the vulnerable population in our communities. We do know that there's been a lot of talk about COVID booster shots from Pfizer and BioNTech. We do know that there's a push actually to have it open to the public in the United States. And in that case, we do see that there's very high numbers of people that have expressed interest in the boosters. It's encouraging, but at the same time, the question is it really something that we want to continue doing over time? Yes. It's shown that those who take the booster shots have a very high percentage of, I would say, protection against the COVID. And therefore, if you have the opportunity to do that, I will encourage you to do it as well. At this point, we only have the Pfizer one that is approved in the United States for booster shot. Those who qualify for it include, for instance, the BioNTech or Moderna. We do have those 65 years and older, those who age 18 and more, who are actually living in long-term facility cares, and also individuals who have underlying conditions and high risk. For Johnson & Johnson, we do know that if you're 18 years and older and have taken a shot 2 months earlier, you should be able to qualify for the booster shot. So I must say that, yes, all these three are available for booster shots, and also the good thing is you can actually mismatch them as well. The categories of people that qualify includes the likes of first responders, healthcare workers, individuals who are teachers, manufacturing workers, postal service workers, and all those included in that category. Again, I said it, you can mismatch them. You can always, if you do think that you qualify for it and you want to get it, you can call your nearest pharmacy or the nearest healthcare center, and they will arrange for you to get your booster shot. Again, this is just to illustrate that there's been vaccinations or vaccines approved for children between the ages of 5 to 11. At this point, I must state that it's only approved for Pfizer, BioNTech, Moderna, and Johnson & Johnson they have ongoing clinical trials to substantiate the utility of this vaccine in children. Again, when you go back to our home country, Ghana, we still don't have that much of our population vaccinated, and this is not different from a lot of third world countries. As already stated, it's less than 5% of third world countries around the world have vaccinated their population, which shows the great disparity that you see when you compare countries. As you stand now, it's only 7.4% of Ghanaians that have been vaccinated. That corresponds to just slightly over 2 million people that have been vaccinated. And most of the vaccines are coming from AstraZeneca and Moderna and Pfizer. Again, the good news is that about a month or so ago, the likes of Hungary, Germany, and the United States donated a lot of vaccines to Ghana. Over 4 million vaccines were donated to Ghana, and this is kind of driving the number of vaccination efforts in Africa and in Ghana in particular. And we hope that this is going to continue so that we can fulfill the COVAX goal of vaccinating at least 10% of the population in almost every country in Africa. So that just brings me to the end of it. If you have any questions, you can go ahead and ask me. But these are pretty much some of the updates that I have at this point.
I thought at one time I read somewhere they were going to get only one vaccine, but I know that when my nephew went, they scheduled him for 2 vaccines. So is it 2 for the children?
Yes, it's 2. It's 2 if it's Pfizer, right?
Okay.
So yeah, so you get a first shot and then a follow-up shot to increase the number of antibody titers for children. The strength is different from adults.
Okay.
It's lower dose.
Okay, so it's still a lower dose of strength. And I'm very happy you mentioned about the mixing. So everyone, it doesn't matter what you got before, please go and get your booster. If you fall in that category, they're not going to ask you any question. You'll show your card and they'll still be able to give it to you. Now, in terms of Ghana, how are they in terms of the booster? Because have they completed like the first 2 series? I don't know. Are they at the booster yet, or?
Nah, I think now at this point we are trying to encourage at least 1 dose for individuals. We sent. I think from what what I read and what I'm hearing is that it's not that many vaccines to go around to get a booster shot, pretty much, right? At this point, if you're saying that the immunity of people wane after 6 months, I'm wondering when these vaccines will roll out. Those who received early, are they actually due for a booster shot? And then again, it depends on the vulnerability of the population and also the prevalence rate. When you look at Ghana, I don't think our prevalence rate is very high at this point, so we can risk it. Looking at only 7% that have even received 1 dose of the vaccine. United States have made a commitment this week to produce 1 billion vaccines to third world countries, including Ghana, that will be able to drive the vaccination efforts up around the world.
Good. We're glad to hear that. And it's good to know that, all the people that I've spoken to in Ghana, they kind of feel like, COVID is no longer there. They're not really.
That's the perception. Yeah. Now, it is there. It's actually killing. At this point, we have almost more than 1,200 people in Ghana that have died from COVID, right? Yeah. If it's not there, nobody will come here and stand at us there. So I think the perception that, hey, COVID doesn't exist in Ghana should be long gone. The only problem is that the case numbers tend to be very low as compared to what we see in the US and other places. But it doesn't still prevent us from continual education, letting people be aware to wear their mask, which I know is non-existent at this point. We encourage people to do that because that's what happened in India, actually, right? So India thought they had it under control, and then there was a spike to the extent that they didn't even prepare for it, So that can happen anywhere. So we are praying that Ghanaians would heed to the advice and make sure that they understand that COVID is still there, it's killing people in Ghana. Actually, every day, or at least every week, we know between 5 to 10 people die from COVID.
So we still need to be practicing social distancing, wearing our masks. Now, I know, Dr. Forey, some time ago, they were recommending for people to wear double masks. Where are we right now with the holidays coming up, Thanksgiving, Christmas? Is your recommendation to still double mask, or are we okay with wearing just?
So again, like I always say, right now, I think COVID is like going out like the weather, right? So you have to check where you're going to be able to know how endemic the area is. Okay. And that will kind of give you an idea about kind of protection you need. People who are vaccinated and fully vaccinated actually can spread the virus itself, right? The only thing is that their chances of spreading the virus is cut really low. It's about 6 times less compared to someone who's not vaccinated. So it still gives you that risk of potentially infecting someone who is immunocompromised or probably hasn't received the booster shot, right? So we encourage people to exercise caution as they move into the Thanksgiving week, into Christmas, as people come closer together, that you could still be vaccinated, but be able to carry the virus to someone who potentially could not be able to mount enough response to that particular virus. Okay.
Back, we're going to actually watch a small segment on WGN that the Ghana Community Health Clinic was on. After that, we're going to bring back all of our guests to talk about the health clinic, hear their closing remarks, and then we'll see you all next week. This is Dr. Araba. We're taking a quick break. We'll be right back.
In the basement of the Africa Community United Methodist Church in Old Irving Park, It was the start of the Ghanaian Community Health Clinic.
And we're going to get your blood sugar.
The clinic is scheduled for the second Saturday of every month at different locations, providing resources to those who are often underserved and uninsured.
I feel like it's my calling.
OBGYN Dr. Jamila Oko is helping with women's health consultations.
When you manage some potential health problems prior to pregnancy, the actual health outcomes actually improve for both mom and baby.
The Ghana National Council estimates more than 50,000 Ghanaians live in the Chicagoland area.
We want to be able to bring quality, evidence-based health care to them.
Dr. Eunice Cromwell says part of that is removing language barriers.
We have people who speak all different Ghanaian languages here who can be able to reach out to them and be able to explain everything to them in their own language and words that they can understand.
Studies have shown across the board that when people who are familiar with the culture of the patient, if the providers are familiar with the culture of the patient, it goes a long way to provide better care to those patients.
The clinic is offering COVID testing, assistance with Medicaid and Medicare, and screening for conditions like hypertension and diabetes.
Your A1C determines if you are diabetic.
The type of care many may have postponed as the pandemic drags on.
Are you feeling like dizziness?
But they need donations of medical supplies and money. The clinic is free and staffed by a team of volunteers like Dr. Prince Hodobe.
It is better for me to volunteer my time. If I'm able to volunteer my time in the community to save one life, that is one less funeral to go to.
In Old Irving Park, Gaynor Hall, WGN News.
My name is Eunice Cromwell and I'm the business manager of the Ghana National Council. Make sure you always watch Trend Africa TV.
Welcome to Africa.
Thank you once again for tuning back. We'll go ahead and bring back all of our guests so we can go ahead and just discuss the health clinic and see what everyone's views were. I know Dr. Chris was unable to make it because he traveled, but he did send someone to come. So we still want to hear in terms of the lab and diagnostic services. Also, now that we know about the sliding scale and the different insurances that they receive, I just want everyone to be very, very comfortable to come to our clinic every second Saturday. So you can be able to get health services. This is what we are all here about. So Dr. Chris, let's start with you. I know that you weren't there, but what do you think about this whole initiative with the health clinic?
I think it's an excellent idea. I just hope that you're able to have a lot of people willing to take advantage of those services. And I think that as we go into the flu season, things are going to get a little bit dicey because one of the things that clinicians are going to be wrestling with is how to rule out COVID versus regular flu symptoms. And one thing that we have done in our laboratory recently is that we are able to test both for COVID and influenza swab, so you don't have to swab the patient multiple times.
Okay.
Yeah, which is actually very helpful. So we're able to do that. All this is in preparation for January, February season when you're going to have a lot of people coming up with different types of symptoms. The laboratory, as I mentioned earlier, we accept all kinds of insurances. Public aid, private, and so on and so forth, Medicare, Medicaid. But at the same time, we have a fee schedule for people for basic testing. And also we have a sliding scale for people that are unable to pay. That's only offered in our Chicago office, which is 11,000 Halsted in Chicago. Because that's a federally underserved location. We got the place to get qualified. So if there's any way that we can collaborate further, you just have to let me know, Dr. Araba. But I think from what I see, according to a report from my staff, I think if I read him correctly, he was eager to swab more patients than actually showed up testing. So I think a lot of people were taking advantage of the free test. I think that's about it. Is there any other question that you have for me, Dr. Araba, or anybody in the audience?
Yeah, I think we lost. Yeah. All right. So I think we lost her for a minute, but then I would say that the community health is actually something that is going to help a lot of people. The health clinic is there and it's free for anybody who wants health care, those who don't have health insurance, those who, for some reason, need a second opinion. We always have this organized the second week of every month, the second Saturday, I should say. So in a way, it brings healthcare to the doorsteps of people that really, really need it. Going forward, I think we need to publicize it more so that people will patronize it. Also, we tend to incorporate things that will make it easier for people to come to the health clinic, including providing transportation. So overall, I think it was a great event for the first time we started. Going forward, we try and improve it and make it better. So we advocate that people who are listening to us should spread the word that we always will be there on the second week of the second Saturday of every month to render services to people. So I'll let Dr. Araba continue.
Thank you. I'm sorry, a little bit of connection issue. Thank you very much, Dr. Chris. What I was going to ask you, Dr. Chris, is what do you think is the barrier? I know you mentioned that your technician was wanting to anticipated maybe swabbing more people than what that actually showed up. So in your opinion, just dealing with people, and we are all, we're all Africans, right? What is the barrier to, providing this free service to people and people not necessarily taking advantage of it?
I don't think it's more of a barrier issue. Unlike the vaccination part, COVID vaccine tend to have more barriers to it. The swab shouldn't be a problem. I think that's easily understood by people that you get tested, and the testing is to determine your health status, whether you're infected or not infected. So I just think that we need to publicize it more, and of course we need to make sure that the participants are aware of the fact that we will not disclose their results to anybody in case there's people that might be doubting our ability to keep to that promise. And I think that might be something that might result in some people being hesitant. But we have to assure them that the results are private and that we comply with all HIPAA regulations.
I agree completely. Thank you. And Mr. Apia, go ahead and tell us what was your thoughts about the clinic that we just had on Saturday.
Oh, I was very, very thankful, and I was very, very happy that something like this has been started in the Ghanaian community, because one time I was in Bolingbroke and I happened to be in one of the grocery stores, and the owner told me that a Ghanaian died because they couldn't afford their medication and their insulin. So something like this, that it has been started in a community, can help somebody in that kind of situation. And if they know, at least the clinic can be a help to them, and the pharmacy can be a help to the person, and the lab can be a help to the person. And like Dr. Prince was saying, at least we can save that person, and it will save us in going to another funeral. So I think it's a very, very important in the Ghanaian community, and not only in the Ghanaian community, And my suggestion is after we grow and become a little bit bigger, we can extend it to other African countries which they live, African country citizens that are around Chicago area, that not only for Ghanaians, but for Nigerians, for Ivorians, and any other person who need the services, we can give it to them. And I'm very, very thankful and that we're making these initiatives. And at the same time, they say that Ghana is one of the smallest countries in Africa, but we always lead in the continent. And I think this is one of the things that Ghana is taking the lead in Chicago area and United States so that we can help people from Africa, not only in Ghana. So it was very, very good. And I'm ready to be joined to this community clinic, and I'm ready to help anybody that comes in with all my resources and everything that I have.
Thank you, Mr. Apia. And just for everyone that's watching, even though it is called the Ghanaian Community Health Clinic, it is definitely open to the public. We are open and willing to serve anybody. It's just that charity begins at home. So we needed to make sure that we opened it and made sure that all of our people, all the Ghanaian people and everybody of African descent just knew that we were here for them. But of course, the clinic is open to anybody. We are open, we are willing, and you've heard from our partners, they are also willing to provide all resources to make sure that you get good care. Mrs. Lynda, tell us about your experience. I think you might be on mute.
I am.
Okay.
I am on mute, sorry.
That's okay.
I think it's an excellent opportunity to advocate for our people and others who would need the kind of services that are provided at the clinic. First and foremost, like the medical services, it will prevent a lot of people from self-medicating or sharing medications with others, and allow them to come without fear to the clinic to get services. And from my benefits point of view, a lot of people don't like the application process. You're asking for a bank statement, you're asking for a social security card, your driver's license, your passport, everything under the sun. But some of these agencies, even though they do share a database, they're not really interested in following people whether they have papers or not. It's just a matter of making sure that they're eligible for the service and they get it. The benefits are so many. I would love to advocate and join meetings and be the support for those who come. Make sure that they can apply for the medical insurance that they need. If they can't get the Medicaid, they can get the healthcare marketplace insurance, which is where they send you when you don't get Medicaid. But it is open to all of that. And with Medicare, now we're in the enrollment period, it's important that people know that they can compare plans and save money and get a better drug prescription plan or Medicare Advantage plan than they have right now. And this is the opportunity for them to take advantage of all those benefits. And then I can also introduce other benefits like the LIHEAP, the energy assistance that gives them money for their utility bills. And there's even a water bill support for Chicago, and there's one coming up in the suburbs as well. And then people over 65 can get discounts on their license plate stickers. Instead of paying $150, they can pay $24. So I'm there to give them a wide range of benefits, both medical and other types of benefits that would help support and save them money, instead of spending their income on so many things. If they can't afford the medication, at least they can get help paying for their light bill, or they can get support in another way. So that then frees up money for the medical stuff that they have to actually private pay for. So it's just an opportunity for me to get in there, advocate, educate on Medicare, Medicaid, and other benefits that they can get. And it's amazing the number of benefits that are out there for different age groups. There's even a website run by the government that is called Benefit Finder. You go in there and you can just answer questions, and it comes up with a huge report about all the benefits there are out there for you. So I just think it's an excellent opportunity to just make sure that people get what they deserve and what they're eligible for.
Thank you so much. And we are so grateful. How blessed is the Ghanaian Community Health Clinic for everyone who has heard everything today. Again, if you came in later and you didn't hear the whole show, just go back and listen to all the variety of things that are going on in this health clinic. Make sure that you tell a friend to tell a friend every second Saturday of the month. Now, we are mobile, so I won't say that we'll always be at Methodist Church. We will choose different locations to go to. We're working with lots of other partners to find different locations and places that we can be of more service. But know that you'll get all the information, and just make sure that you make a date to spend some time with us on the second Saturday of the month. I'm going to go ahead and give my guests an opportunity to give their closing remarks so we can have the community announcements. So let's start with Dr. Chris. Dr. Chris, what are your closing remarks this evening? And once again, thank you very, very much for taking your time to spend with us this evening.
Well, thank you, Dr. Araba, for inviting me to participate in this process. I am very thrilled when I get the invitation, because this is consistent with the kind of thing that I like to do. We're all busy doing different things, but once in a while you need to pull back and give back to the community, and I think that's a very vital thing to do. So anytime that you have a need for laboratory work, especially kids that are back to school type of things, are things that we tend to support. We not just with vaccination, because we do vaccines, not just COVID, but other type of vaccination. We also do things like testing for lead, which is required for kids of certain age. And of course, we do back to school laboratory testing like TB, tuberculosis testing, and especially for those people that are also in the nursing program or about to get into some clinical rotations or whatever. The lab does do some quantiferin TB testing and so on and so forth.
Excellent. Thank you very, very much. We appreciate you being here. Have a wonderful night, and thank you once again for joining.
Thank you.
Thank you. Mr. Apia?
Yeah, I'm thankful for you guys inviting me to join the Ghanaian Community Clinic. I'm very, very thankful, and I'm praying that everything will be as successful and we can all put our resources together to help the uninsured people, the insured people, and everybody who need our help. I'm very, very glad, and I hope this one will run and we can help a lot of people.
Thank you. And thank you once again for your services, and thank you for joining us. Have a wonderful night.
All right. Thank you.
You're welcome. Mrs. Lynda?
Oh, thank you. I just want to say thank you also for inviting me to join you at the health clinic, and to say that I am open and I'm available outside of your clinic hours. I do this on a day-to-day basis. I can fit people in to my schedule. If you have a question, if you talk to you, just call me and I'll fit you in. I fit in somebody today. We did a 3-way call with the Medicaid guys. We're able to find out information about her application, and it worked out. So I can help you out by fitting you in, and I'm open to that. So I just welcome everybody to contact me, and I'll see how I can help. But all we want to do is to help. So just come on out. Thank you.
Thank you very, very much for joining us. We appreciate you, and have a wonderful night.
Thank you.
Viewers, we're going to take a quick break. So when I come back, we'll give a few community announcements, and then we'll see you again next week at the same time. This is Dr. Araba. We'll be right back.
It's Hot Ice exclusive on the beat.
Eunice Cromwell, and I'm the business manager of the Ghana National Council. Make sure you always watch Trend Africa TV.
Welcome to Africa.
Thank you once again for tuning in today. We really appreciate you. There are some comments I didn't forget. We were just trying to make sure that we heard everything from our viewers, but let me quickly go there and read any of the comments that we have this evening. Okay. And we have comments from Dr. Afori. He says, Health Talks is the best show. We truly appreciate his presence always on the show. Mr. Bennett says, nice program. Mr. Adiesu says, watching live. Mr. Candy says, big up. Mr. Pakwasi Sam, who is GNC's president, says, Arc Bank Ghana, thanks you so much. We have another message from Mr. Adiesu, who says, Dr. Edward Afori, I'm watching you live. And of course, Mr. Pakwasi Sam is giving us a thumbs up. We have numerous people who have shared the page. We just appreciate everyone. And so let's just talk about a few community announcements. First and foremost, I'd like to talk about FLERI Health Insurance. Now, remember, FLERI is a health insurance remittance program that is going to give you peace of mind by offering you a way to provide healthcare benefits for your loved ones back home. So we spent a lot of time today talking about what we can do for ourselves to make ourselves healthy. We have the community health clinic, but then when you think about the stress and the pressure that we have also because we have to send money back home, that also can, contribute to a lot of health issues that we can have here as well. So FLERI is a company that can give your loved ones back home in Africa the gift of better life. It's currently available in Ghana, Nigeria, Zimbabwe, and Zambia. They're working on other countries, so continue to send in your requests. The more requests they get from other countries, they're able to find insurance companies, they're able to partner and bring that good service. So under this plan, it covers doctor's consultations, dentals, opticals, and lab testing, prescription delivery. So if you want to know more about it, please visit the website at www.joinfleri.com. Next, I want to talk about the Tree Learning Center, TLC. They are a company in Ghana that are offering lessons for people to learn how to speak Fanti and Tree. They have a partnership with Ghana National Council, so if you use their code TLC-GNC-21, you'll receive 10% off for your Tree or your Fanti lesson. Yes, I am a proud student of that organization. So for more information, you can always contact me at 773-526-9493. Next, I want to talk about Express Med GH. They are a wonderful organization in Ghana that's also providing personalized services for people who need healthcare in Ghana. So if you have a family member that needs to speak to a doctor on the phone or needs someone to come and see them, looking for help, any kind of advice in terms of health needs, you can call them via WhatsApp at 05420-53335 or 020-266-0061. Check them out on their website, www.expressmedgh.com, or you can email them at expressmedgh@gmail.com. Last but definitely not least, I'd like to invite everyone in the community to celebrate. Oh, before that, I'm sorry. Africa and Beyond is providing us with delicious snacks and for every event. Okay? You can reach them at 773-712-5036. You can email them at africaandbeyond22@gmail.com. They do accept Zelle at 773-712-5036. They are also on Cash App at Meki Meninja. So if you need any kind of snacks for your next event, look no further but contact Africa and Beyond. Don't forget also that Trend Africa TV, in order for us to continue to bring you programs, we will need your sponsorship and we will need your support. We do have a lot of things under our Trend Africa TV umbrella, which includes Trend Africa Radio, Trend Africa TV, Trend Africa Ghana. I mean, it's just growing and growing, and it wouldn't be where it is today if it wasn't for the support of all of our viewers. So continue to share the word, continue to share the page, visit our social media pages, and also send in any donation that you can to our Cash App, which is going to come across the screen. I believe the number is, I know my producer will show it very shortly. Let me see if I can find the number for you all. That's it, 773-312-0318. You can send your Zelle or Cash App donations there. That's also the number you can WhatsApp us if you had any questions or concerns during the show. Also, don't forget, with Ghana National Council, you are able to promote your business with us on a yearly basis or every 6-month basis by just contacting us for affordable rates. Once again, you can contact me directly, 773-526-9493. And lastly, I'd like to invite the community to celebrate the life of my dear uncle who passed away in Ghana. We'll be having his traditional funeral service here on Saturday in the Chicagoland area. It's going to be right across the street from the Leak & Sons Funeral Home at their Fellowship Hall. That is 7852 South Cottage Grove in Chicago, 60619, 6 p.m. to 12 a.m. Mr. Kweku Tewia Ananunu is the senior brother of my father. He will be sorely missed, and we would appreciate everyone to come and celebrate the life of this great man. My conclusion: clinical laboratory services provide needed information to ensure correct clinical decisions that influence patient outcomes and healthcare costs. Improved patient outcomes will ultimately lead to decreased medical treatment costs.
Yes, as I am, without one plea.
Readmissions. So make sure you check out on the Ghanaian community. Also, don't forget to share the word and join us Saturday as we celebrate Tewia Ananunu. I'm Dr. Araba, and my favorite quote: if the sun is not shining on you, let it shine through you. Until next time, God bless you, and God bless our homeland, Ghana.
Oh, Lamb of God, I come, and thou beest me to come to thee. Oh, Lamb of God, I come, just as I am, without one plea. But thy blood was shed for me, and thou beest me to come to thee. Oh, Lamb of God, I come, and thou beest me to come to thee. Oh, Lamb of God, I come, I come. Miti kuma ayo ashema ewu razina miri refrewu wa Shema Ewu Razina Miri Rifrewu Watum Ehu Mobo Kapi Menya Kopo Kumi Mobo Menya Kopo Kumi Mobo Menya Kopo Kumi Odu yefu kesi nabe onyi temo oh Jesus okasama akuma tonye dofu teji says me
Welcome to Trend Africa.